Now you're ready.
Hello, welcome to our event today on COVID-19 vaccine. This event is a community initiative by Family Wellness Club. I am Mangalis and I'll be the moderator for today's event. We all know that COVID-19 is highly infectious and it is spreading very fast. COVID-19 does not discriminate anyone. It doesn't care who you are, what you do, or how you live. COVID-19 will infect anyone and everyone if it is got the opportunity. So we are all at risk of COVID-19. We have planned this event today to cater for people from all walks of life. So we hope that they will have a better understanding of the COVID-19 vaccines. We have lined up an expert panel of doctors. They are all family medicine specialists. Now, some people asked us, what do family medicine specialists do? So we asked them, and this is what the speakers told us. Their work focuses on holistic and comprehensive management of their patients. They manage holistically all age groups from child to adult. That is from the womb to the tomb, and they cater for all medical conditions with emphasis on prevention and for early detection and early screening so as to avoid serious illnesses due to late detection. They manage diseases like diabetes, hypertension, as well as acute headaches by monitoring these illnesses and focusing on the patient's behavior modification. A key component of their work in primary care is vaccinations. They are experts in vaccines because vaccinations help to prevent diseases. They take the role of parents to patients because they treat the patients and the family, and hence the term family medicine specialist. Now, for our event today, in the first part, we will have each of our panel speakers giving a short presentation on something about vaccines. The purpose of this is so that people will have a better understanding of the role of vaccines in the prevention and control of diseases. Now, after that, our speakers will share some facts on some of the issues concerning COVID-19 vaccines. So let us now welcome our speakers. Hello, Dr. Amelia, Dr. Yap,
Hi.
Hi.
Dr. Parantaman. Good
Hi.
to see you all, and thank you for coming today and joining in this event. Okay, I will start off with Dr. Amelia's presentation.
Right. Thank you, Ms. Mangalis, for inviting me to give this talk on vaccines, especially the COVID-19 vaccine. So,
Dr.
in the
Amelia, can I say something about you first?
sure, go ahead.
Okay, Dr. Amelia. Dr. Amelia is with the Ministry of Health, and she was the first family medicine specialist at the ministry's Klinik Kesihatan Greentown in Ipoh, where she has been working since September 2019. And she has also worked as a family medicine specialist in Perlis and also as a general practitioner in the United Kingdom for 4 years. And she has actually all in as a family medicine specialist, 13 years experience. Dr. Emilia is currently a member of the expert panel committee for Parax dengue and maternal health. She's also involved in several clinical trials, including a recent COVID-19 trial. Dr. Emilia also regularly co-manages the Kinta COVID Assessment Center and Vaccination Center. She is married with two children, uh, uh, two sons, two teenage sons, and her hobbies include gardening and cooking. So thank you, Dr. Emilia. Very nice of you to come. So please share with us your presentation on vaccines.
Right. So, as I was mentioning earlier, in the next few minutes, I'm going to try and give an overview of vaccines, in particular the COVID-19 vaccines. So, give me a few minutes. Let me share my presentation. Right. So, let's start with the first question. Can you see my slides?
Yes.
Yes. So, what are vaccines? Now, vaccines are products which are made to prevent diseases, serious and dangerous infective diseases which can kill or cause permanent severe damage or disability. So, how do they work? Now, vaccines work by stimulating our immune system to produce antibodies, which are large proteins which work to destroy germs. I like to call them our army of cells. So, to understand how a vaccine works, we need to know the content of these vaccines. So, there are three main approaches to making a vaccine. We either use a whole virus or bacterium, or parts of the virus that trigger the immune system, usually the outer coat or the clothes of the virus, or just the genetic material. And you may wonder, if we are inserting a whole virus into our cells, why don't we get ill? Because the virus is dead or weakened. Because you see, the body recognizes the germs by looking at their clothes or their outer coats. So, what we do when we make vaccines, we try to mimic the shape of a virus or a bacterium and fool the body into thinking that it's actually being attacked by a virus, and therefore it will release antibodies. Now, these antibodies will be stored in our bodies, and if we are unfortunate enough to encounter the virus or be attacked by the virus, we've got enough antibodies to destroy the germs. So, when do we need vaccines? We need vaccines, obviously, to prevent infection and therefore prevent the disease. But more importantly, we need vaccines to prevent hospital admission, because vaccines prevent severe forms of the disease, such as admission into the intensive care unit. And ultimately, vaccines prevent death. That is the ultimate goal of a vaccine. So, what vaccines are recommended in Malaysia's immunization program? I'm sure you've heard of the hepatitis B vaccine, diphtheria, polio, pertussis or whooping cough, and tetanus. And then there's the Haemophilus influenza B, pneumococcal, measles, and the new kid on the block, human papillomavirus vaccine, which is prevention against cervical cancer. And then there are the other diseases where vaccination is advised, such as the meningococcal vaccine for those planning to do their pilgrimage in Mecca for Hajj or Umrah. This is to prevent meningitis, which is quite prevalent in that side of the world. And then there's the influenza vaccine, which is recommended for healthcare workers and those with chronic diseases, such as those with asthma, chronic lung diseases, diabetes, and kidney diseases. Now, the last question, why do we need the COVID-19 vaccine? COVID-19 is a new disease. Our bodies do not recognize COVID-19. Therefore, we do not have the antibodies. Why do we need the antibodies against COVID-19? Because it is deadly, it is contagious. More than 160 million people worldwide have been infected with COVID-19. More than 3 million have died. In Malaysia, almost 500,000 have been infected. More than 40,000 are being treated for COVID-19 disease. Almost 2,000, if not already 2,000, have died to this disease, and more than 100 in the past 3 days. So it is war out there. We are fighting against this invisible enemy, the COVID-19 virus, and we need to protect ourselves. We need to um, we need antibodies to fight against this disease. It's like, I'll give you an analogy. We know that we are being an enemy is advancing. It's just around the corner. And we are sitting here in our fortress thinking, do we just wait? Are, is the enemy going to attack? Is the enemy going to kill us? When all we've heard is that it's attacked so many people, it's killed so many people. So we need to do something. We need to gather ammunition and gather our weapon and try to think of a way to prevent the enemies from invading our fortress. Now, the same principles apply with COVID-19. We need to stop the virus from attacking us by building antibodies. And the quickest way to build antibodies is by injecting ourselves with the COVID-19 vaccines. So we need to get vaccinated as soon as possible. Thank you.
Thank you. Thank you, Dr. Emilia Hazrina. It was a very powerful presentation. Yes. And, okay. Thank you.
You're welcome.
And I like your analogy about the fortress. We are all in a besieged fortress now, and we got to plan our move. Yeah? Okay, thank you. Now we'll go on to our next speaker. And our Dr. Yap will be giving us our next presentation. Just a few words of introduction about Dr. Yap. Dr. Yap Fungan is a very senior doctor. He is currently has his own private practice as a family medicine specialist, focusing on home medical visits to patients who are housebound. Dr. Yap has worked in the Ministry of Health in various capacities, and his last post was as Hospital Director of Sungai Siput Hospital in Perak. After his optional retirement there, he started his current practice. Dr. Yap has been very involved in teaching medicine to students. He was a lecturer for medical students under the MBBS program at UniKL, Royal College of Medicine, Perak, for 18 years in various capacities. Dr. Yap has a conjoined degree of Academy of Family Physicians of Malaysia and Fellow of the Royal Australian College of General Practitioners. Thus, he has been a mentor for trainee doctors for 19 years. Since 2018, Dr. Yap has also been a mentor for newly graduated doctors under the voluntary mentor-mentee program of the Paramedical Practitioner Society. Dr. Yap is very passionate about lifelong, continuous learning and personal development. Dr. Yap, good to have you here. Please give us your presentation on, I believe it's on the history of vaccines.
Thank you, Ms. Mangalis, for your kind introduction. And I like to take this opportunity to say welcome to all who are joining in to watch this forum, and a special hi to my friends, colleagues, and family members who are also watching. Well, my task is to talk about COVID-19 vaccine, and I will touch on the history of it. Being senior, so I like to go into history a bit. To start with, we all know this very well-known phrase, prevention is better than cure. I think we can start the slide now.
Yes.
Now, the best prevention always consists of multiple methods. Next slide.
Just,
Now,
can you see the slide?
yes,
I
yes,
can't.
yes.
Oh, yes. Okay. Now it's on. All right. The next slide. Yeah.
Yes,
Okay.
please. The best prevention always consists of multiple methods, and each of these methods is important. Number one, keeping healthy and fit by balanced nutrition and regular exercises. Number two, what we all know now, the physical measures that we should adopt for COVID-19. That is maintaining a physical distance of at least 1 meter between people, wearing face masks, and frequent hand cleansing. Frequent hand cleansing, you can do that with soap and water at home, and when you are out, it is good to have in your pocket, carry with you hand sanitizer, so that whenever needed, you can clean up your hands. And next slide. So I'm going to history now. So I'm going to talk about, there's a slide before this. We are going to talk about a smallpox vaccine. Smallpox vaccine is the oldest vaccine we have. So let's say a few things on smallpox, which is a viral illness. It existed more than 10,000 years ago and even found in Egyptian mummies 3,000 years ago. Okay, so it has caused multiple epidemics throughout history. For example, in 1967, 15 million people contracted smallpox, out of which 2 million died. It's a multi-organ disease causing multiple problems to parts of the body, skin, blindness, brain, even lungs. So now the next slide show you a picture of a Bangladeshi girl who suffered from widespread skin lesion from smallpox. And that was in 1973 when Bangladesh was experiencing a smallpox epidemic, resulting in the smallpox vaccination. And because of the smallpox vaccination, by 1977 December, the country was free of smallpox cases. Free of smallpox cases, that means zero. So the vaccination campaign was so successful. Looking at the larger picture globally, the multiple epidemics are going throughout the 1800s and 1900s. And because of the vaccination campaigns that were going on at the time, so the world managed to eradicate smallpox as well. And by 1979, the WHO actually declared that the global eradication of smallpox. So as a result, we actually don't need smallpox vaccine nowadays. So let's go a little bit about who created smallpox vaccine. It was created by a British doctor, Dr. Edward Jenner, and that was in 1796. Now, our next picture I show you an art piece created in 1808, and it shows a group of people on the left side who were actually the anti-vaccination campaigners that time, and on the right there is Dr. Jenner and his two colleagues. You can see the anti-vaccination smallpox, anti-vaccination campaigners retreating with no dead babies on the floor, on the ground, and they died because of not getting smallpox vaccination in time. So on the right, you also notice an angel putting a little crown onto Dr. Jenner's head in appreciation of the great effort that he was doing. And nowadays, we are healthcare workers, and I think they also deserve similar appreciation. So, and next piece, next slide, I've already described it. So, I've already described it just now. So, let's know a little bit more about the oldest and the newest. The oldest is the smallpox vaccine. The newest is our COVID-19 vaccine. So smallpox in 1967 caused 15 million people to be sick with smallpox, out of which 2 million passed away. And COVID last year caused 82.5 million cases, and out of which 1.8 million died. So by now, less than 6 months into this year, 2021, the number of cases has already doubled. In fact, a little bit more than doubled. The death case is hasn't doubled yet. So in a way, showing that the healthcare measures and other measures, preventive measures, have to some extent showing some effect already. Now, smallpox, multi-organ complication, COVID also the same. Let's look at the next slide. So now COVID-19, we all know it affects the breathing system, the lungs, the nose, the throat. But besides that, it also affects the heart, also affects the stomach and intestine, the kidneys, the reproductive system, or the brain, and also the blood, causing problem with the blood, causing a lot of problem there, including clotting problem. So next slide. Next slide. Now, the vaccination for smallpox managed to eradicate smallpox over 200 years. What about COVID-19? It is a new disease, a new infection, and new things are still coming up about it practically every day, if not every week. All right. So it's that very important for vaccination to control it. So we don't aim to eradicate it now, but we aim to control it so that the number of cases can be as few as possible. And besides vaccination, of course, other measures are also important. And even nowadays, with smallpox, we have the oldest anti-vaccination campaign, and nowadays we have the newest anti-vaccine campaigners also exist nowadays. Next slide. Okay, okay. So the other vaccines around has already been mentioned by Dr. Amelia, and there are vaccines actually available for 25 infections. For the future, because medical research is going on all the time, and a lot of technological advances are there. So we even are thinking of using vaccine against or prevent non-infectious human diseases like cancer, these autoimmune disorders, and even for high blood pressure. Okay, so next slide. Next slide is quite important to show. Now, World Happiness Report comes every year, usually in March. So, World Happiness Report 2021, Chapter 4, states COVID-19 has exposed many acts of heroism, notably among frontliner workers and healthcare workers who have battled the disease at great peril to their own safety, often without the benefit of even rudimentary personal protective equipment. In Malaysia, we are quite fortunate. We are not so bad as to have inadequate personal protective equipment. Whenever there are logistic gaps, there are always the public and NGO coming in to help out. So I'm coming to the last slide. So uh, we have gone through the history of very successful eradication of smallpox because using vaccination as an important tool. So COVID-19, so let us cheer to the COVID-19 vaccination. This picture on the left the picture on the left show a group of frontline healthcare workers in Ipoh Hospital, the Ipoh Government Hospital, after receiving their first dose of COVID-19 vaccine. And they're still working very hard in the hospital because of the large number of new COVID-19 cases. And on the right side of the screen on the slide is myself having received the two doses, having just received my second dose of COVID-19 vaccine. That was about 12 days ago. And now I'm talking to you. So with that, thank you for your attention.
Thank you very much, Dr. Yap. The first vaccine for smallpox was discovered almost 3 centuries ago. And it's good to hear that it was the smallpox vaccine which finally we managed to eradicate smallpox. So thank you, Dr. Yap, for that very interesting story too on Dr. Jenner and anti-vaxxers. Yeah. Anyway, we have now heard from Dr. Yap on the oldest vaccine. Our next speaker will share with us some information on the newest vaccine. Welcome, Dr. Parantaman. Dr. V. Parantaman is with the Ministry of Health, and he is a family medicine specialist and also the head of the ministry's Klinik Kesehatan Greentown in Ipoh. He has worked in the Ministry of Health for the past 26 years and in the primary care field for the past 21 years. He has also served in Sabah. Dr. Parantaman is involved in COVID-19 management in the primary care field since the outbreak of COVID-19 last year. He has also been involved in clinical trials on COVID vaccines. Currently, he is in charge of the Kinta COVID Assessment Center, where mild cases of COVID positive patients are managed, and he's also involved in the vaccination center for Ipoh. Dr. Parantaman is married with 2 children, and his interests besides his work include music, he plays the organ, and he enjoys going on nature walks and hiking. Welcome, Dr. Parantaman. Please do share with us on something on COVID-19 vaccines.
Thank you, Ms. Manglish, for the very kind introduction. And I would also like to extend my warm welcome to all of you who are attending this forum. So I will proceed to share my slides. Following up on the previous 2 speakers, Dr. Amelia and Dr. Yap, so I'll now zero in on the types of vaccines that are available. So let me share. Just a moment. Yep. Are you able to see my slides?
Yes. Coming.
Yes.
Yeah. Okay. So so the first thing is what are the vaccines available worldwide? Currently for COVID-19. So worldwide, we have many vaccines. Particularly, you may have heard of the AstraZeneca vaccine, the Pfizer vaccines. There are also other vaccines worldwide like Moderna, even Sputnik 5, yeah, Johnson and Johnson, Sinovac, or also called the CoronaVac, Sinopharm, Covaxin or Novavax, yeah, many in the world, yeah. But ultimately, what matters is what we have in Malaysia, right? Yeah. So after all, a bird in the hand is worth two in the bush, as I say. Yeah. So that's what matters. Yeah. This is what we have in Malaysia currently. So we have the Pfizer vaccine and also the Astra and the Sinovac vaccine. These are three ones currently we are having. There may be more in the pipeline. Yeah. But these are the ones currently. Yeah. So people have asked whether these vaccines have undergone sufficient trials for use in people. Well, let's look at Pfizer vaccine, which is also called the Comirnaty, yeah, in Malaysia. So they've done a phase 3 studies, which have been already published, more than 40 over 1,000 participants, and of which they found that it has about 95% efficacy against COVID-19, yeah. And AstraZeneca, they have more than 30 over 1,000 participants. Again, it has a very high efficacy at preventing symptomatic COVID-19, close to 80%, and it has been noted to have 100% efficacy against severe or critical disease and hospitalization. Similarly, in Sinovac, let me just zero in the latest one, Indonesian data. They've done some studies there, and it has protected about 94% against infections, 96% from hospitalization, and about 98, close to 100%, yeah, of the health workers from death. Yeah. So these are the types of vaccines we have, and so before I go on to the common side effects, yeah, it's a bit difficult to compare these vaccines. I'll come to that a bit later. Yeah. So these are the common side effects of all vaccines. The three vaccines, you may have pain and redness and swelling in the arm once you take it, and of course in your whole body there may be tightness, headache, fever or muscle ache, and so on. In particular, for the Pfizer vaccine, it may be worse after the second dose. Yeah, right. And serious side effects, yeah, which is actually quite rare. Now, the main ones is actually anaphylaxis, or what we call as a very severe allergic reaction, which can be life-threatening. So the data shows that it's only about 17 in a million in Malaysia. Yeah. Also, the much touted about news about the blood clots in AstraZeneca, it's only about 4 to 11 in a million, yeah, which is considered rare actually, yeah. So if I were to compare, with other incidences, let me blow up this slide. It looks a bit busy. So if you look at this, the chances of a person dying of coronavirus, yeah, for example, a younger person, it's about 23 in a million, which is higher than taking the vaccine itself. If you're much older, say 55 years old, it is even much higher, 800 in million, yeah, died due to COVID. Yeah. Even those who are dying of accidental injuries, for example, car accidents and so on, it is also very high, 110 million, and it's higher if you're older. Road accidents, for example, it's also higher. Yeah. So as you can see, the side effects are there, but that definitely we have to put it in perspective. Yeah. And before that, there's some of us who may talk which vaccine is better, example, yeah? But actually we can't really compare all these vaccines, yeah, because they've done the trials at different periods at different populations. Yeah, some was done earlier. For example, Pfizer vaccine trials were done earlier when the COVID outbreak was actually not so bad. Yeah, so maybe the outcome was better. Yeah, you can't really compare all these vaccines, just like you can't compare two different cars. Yeah, I like to put cars, yeah, as an example. Say, if you prefer a BMW or a Merc, yeah, you can't say which is better. As long as they're comparable and they're approved, they're safe enough, then it should be okay. Yeah, what matters is it protects you against death. Yeah, for example, in WHO, for their standards, as long as it is more than 50% protection, the vaccine is actually approved. Yeah, right. And for those who say, we do not want to have any side effects, well, no vaccine is actually 100% safe. Yeah, I have to admit that. Yeah, it is never safe 100%. Nothing in life is 100% guaranteed. Okay. For example, if you were to drive a car, seat belts will protect you. Yeah, airbags will protect you, but can they prevent you from an accident totally 100%? no guarantees. It is just a supplementary, an aid, to prevent severe damage or injury, even death. But nothing is 100%. The only thing sure in life, the only thing we are sure in life is taxes and death, as they say. That is 100% guaranteed. But we do not want to die so soon, right? Okay, so let me go on to the national immunization program. There are a few phases. The phase one is the national program to vaccinate the frontliners, and then now we are going on to the phase two, which is involving the senior citizens and high risk groups, and then on to the phase three, for the rest of the population. But if we were to look at the status of the vaccine registration in Perak, the numbers are actually quite low. You can see that it is less than 40%. Even the other day, I had some patients coming into my clinic, wanting to get swabbed. But when we check, they haven't even registered for their vaccination. So that's the irony of it. Many people are worried about COVID, but not as many are actually registering for the vaccine. Yeah. So I will just sum it up. Basically, we need to vaccinate for our self protection. But it is just one of the tools in the armament against COVID. We still need to follow the other SOPs, wearing a mask, as Dr. Yap mentioned. Hand washing. Social distancing. All these are very important to prevent infections and to spread of COVID. Here, the picture is showing our DG himself, Director General of Health, vaccinating. That is me actually. I've also done my vaccination recently. Okay, with that, I thank you for your time and attention.
Thank you, Dr. Parantaman. That was a uh, good overview of the vaccines we have and some of this one. Now we go on to Dr. Emilia. Dr. Emilia, I have a few questions for you. I thought since they're all related, we can put them all together. Now, some people have been saying, why get vaccinated when after all, after vaccination, there are still people getting COVID-19? My question is there any vaccine that is 100% proof? And the second question is about efficacies of the various vaccines. What does it mean when we say Pfizer, BioNTech, the efficacy is 95%, whereas, for example, Sinovac may be 60, 70%, Astra may be 80%. What do these efficacies mean? And the final question is, can we just look at the efficacies of the different vaccines to say one is better than the other? These are the three questions.
Okay, Ms. Mangles. So the first question, is the vaccine 100% foolproof? Is that,
yes, correct.
Yeah. So is it foolproof to prevent against COVID-19? The answer is no. No vaccine is 100% foolproof to prevent against diseases. We've never claimed to be able to do so, because I know the aim of giving a vaccine is to prevent the infection and the disease, but the more important aim of vaccination is actually to defang or to tame the virus, so that if you contract the disease, you won't get the severe form of the disease and you won't die. So that is actually the main goal of vaccination, to prevent severe complication of the disease and to prevent death. Now, you mentioned the efficacy, right? Efficacy rates are rates quoted by clinical trials. See, when we do clinical trials of vaccines, we actually recruited tens of thousands of participants. And these participants are divided into two groups. One group is vaccinated and one group is not vaccinated. And then we let them go, and then we see who gets infected with a disease. So for instance, for the Pfizer vaccine, 43,000 people were recruited in that study, and 20K was given vaccine, another 20K were not vaccinated. And the result of these clinical trials, if 50% of the vaccinated gets the disease and another 50% also from the unvaccinated also get the disease, the efficacy rate is 0. That means there's no difference whether you get a vaccine or not. For Pfizer clinical trial, what happened was 170 people got infected with COVID-19. And from that 170, 162 were from the unvaccinated group. 8 people were from the vaccinated group. So that's how they calculated the efficacy rate of 95%. It actually means if you're injected with a Pfizer vaccine, you are 95% less likely to get COVID-19 compared to if you're not vaccinated. So that rate is, calculated similarly with the other vaccines clinical trials. So you can't really compare. So when the efficacy rates for different vaccines, because the clinical trials are done differently. For Pfizer, it was done in the United States, among Americans, during the summer. For Sinovac, it's done in Chile, South America, in Indonesia, among a different population, different numbers, different countries, different climates. So it's not actually, there's no head-to-head comparison between the vaccines. So you can't really compare the efficacy rates of each vaccines because these are the rates for the individual. It's like comparing an apple and a durian. Both are fruits, but you can't really compare them. So if you ask me, can we compare which vaccine is better? Let me tell you, all the vaccines which have been approved by the WHO have consistently shown one fact. They all prevent severe illnesses and prevent diseases 100% or almost 100%. And that is actually our goal. We want to prevent death and we want to prevent severe complications from the disease. And all these vaccines do that. So it's quoting the efficacy rates can be quite misleading and confusing.
Thank you very much for that, Dr. Emilia, because we have cases where people who have registered for vaccination, they want vaccine A, but when they go there, they get vaccine B, they say no, they don't want to be vaccinated. So at the end of the day, all vaccines give us protection, at least against severe disease and severe symptoms. Exactly.
And death.
That's good. And death. Death. Yes, that's the most important.
And the best vaccine is the first one that you can get into your arms.
Yes, don't give up the opportunity to get a vaccine.
Definitely. Yeah. A delay in days can cost you your life. So don't delay.
Yes. That means take whatever vaccine is available to you.
Yeah.
Definitely. Yeah. Thank you, Dr. Emilia, for that. Okay.
You're welcome.
Now we go on to the next issue. And this one is on the very much publicized issue of blood clots of the AstraZeneca vaccine. So I would like to ask Dr. Yap. Dr. Yap, what is this rare blood clot that people are saying is they are afraid to be vaccinated, and now we are going to roll out, or not really roll out, it's an opt-in service for 1 million doses of AstraZeneca, and priority is going to be given to the 60 years and above. My question is, what are these rare blood clots? What is the chance of someone getting this rare blood clot if they are vaccinated with AstraZeneca? And is there any particular risk for those 60 years and above? Because they are the ones who are afraid, because some have heart disease, some may have stroke and hypertension. So is this a kind of a blood clot that they should be fearful of?
That's an important question, since we are pushing out AstraZeneca COVID-19 vaccine for those who are above 60 50 years old. Now, the clot problem, the exact name for this clotting problem associated with this vaccine is a thrombosis with thrombocytopenia in medical term. In layman term, you can put it as a condition of clotting with low platelet count. And now it is quite different from other clotting problem we know. In this case, the major area of clotting occur actually in quite major vein space in the brain and causing the symptom of headache. Occasionally, it can occur in a major vein space in the tummy, resulting in tummy pain. And actually, treatment is available for this condition. Well, as I mentioned just now, it is different from the clot problem that cause acute heart attack or stroke. So remember that it's important to know the difference. And then what about the risk? The chance of getting it has already been mentioned by Dr. Paran. It is rare, quite rare. For example, in Europe, the risk of getting this complication from this vaccine is 0.00065%. Now, what about those above 60 years old? The risk is actually 70 times less than the risk of admitting to ICU if unvaccinated and exposed to COVID-19 infection. So it is a very useful vaccine, and as already mentioned, when it arrives, to get it, there's no need to fear the side effects so much because it is rare, and as I've shown you, it's quite uncommon. Yep.
Thank you. And Dr. Yap, we also understand that the rare blood clots are not happening in those in the elderly from this AstraZeneca vaccine. It is more in the those below 50
Much
years
less
old.
common.
Less common, yes.
Of those who are over 60 years old, whom we are recommending the vaccine to. I think they have just started doing that for the elderly in the senior care centers around.
Yeah, thank you, Dr. Yap, for that. So, Dr. Paran, I'd like to ask you about these health conditions. What are all the health conditions that some people may have for which vaccination is not advised? That's the first question. And second question, for those seniors especially who are a little anxious because they have comorbidities like heart disease, hypertension, and they are afraid to go for vaccination because of complications, how can they be counseled?
Yep, yeah, that's a very important point you brought up, Ms. Manglish. So let me spell it out. So the main contraindication for vaccination is actually anaphylaxis. So for those who have severe allergic conditions to any of these vaccines, then we do not vaccinate them because they may get life-threatening, side effects due to the vaccination. Yeah. So that's the main one. But if there's uncertainty, we can also defer or vaccinate in the hospital setting. That is emergency trolleys available and so on. As for health conditions, as you mentioned, yeah, there may be some contraindications or relatively caution we need to take. For example, those with some severe immunodeficiency conditions, such as cancer patients undergoing active treatment, so they may be severely immune deficient, so they may not be able to mount some antibody response to the vaccines. And also those with unstable medical conditions, as you mentioned, those with hypertension, diabetes, generally they're all eligible for vaccination unless it's severely uncontrolled, uncontrolled hypertension or severely uncontrolled diabetes. Then they may be asked to defer and come back later when they are stable. And also certain blood conditions, for example, those with clotting disorders or bleeding disorders, or even some with certain medications which may add on to these problems. Yeah, then we may caution against these patients. For those who are having certain medical conditions, they are uncertain, they are most welcome to still attend the vaccination centers. Yeah, if they are uncertain, there will be usually doctors available there to counsel them and to go through their medical history, the conditions, and to advise appropriately whether they are fit for vaccination or they be deferred, or they are unfit. Totally, they should not be vaccinated. Yeah. So I think they should not fear on this and not do not avoid coming for vaccination. In fact, the first thing they need to come is to turn up at the vaccination center. If they do not turn up due to fear, then we can't even go through and counsel them appropriately.
Okay.
I hope that
Thank you,
answers
Dr.
you.
Yeah, that answers the question. Well, I hope the senior citizens will take note of that. And just one question while we are here. There are a lot of variants coming into our country. The UK variant, the South African variant, which we are told is spreads very, very fast, and now even the Indian mutant variants. Now, are these vaccines that we have now, how effective are they against these variants?
Okay. Is that question to me?
Yes,
Uh,
yes.
yeah.
Oh, oh,
Okay. Right. Okay. I'll continue on that. So these variants, very much in the news lately. As you mentioned rightly, the Indian variant is there, and then the South African variant, and then the British variant as well is there. Yeah, there's certainly some concern about it, because it has been found that the reports, because it's very new, the news is, the evidence is just developing or mounting. So from what we gather so far is it is found to be spreading much more rapidly compared to the original COVID virus, and also some reports say it may even cause a much more severe disease. Yeah, so it is definitely of much of a concern to us. But then again, the COVID vaccine, it treats a generic virus itself. So it may have a different coating on the on the body of the virus. Yeah, but generally the body, our immune system recognizes, yeah, these
yes.
viruses, even the variants as well, and there is a certain amount of protection. In fact, a very high degree of protection, and it is still been found to be protective against these variants. Then again, the evidence is developing, so we will know more about it as the condition, goes on further. Yeah, but this is the evidence so far, and so there is no advice not to take vaccination just because of these variants. Just of concern that they may not protect. Yeah, these are just what you call subunits or subvariants of the same viruses, which the vaccines should be able to protect.
Thank you, Dr. Paran. I would like to ask Dr. Yap, what is your view on these variants and our vaccines now?
Yeah, as mentioned by Dr. Parent, study is ongoing all the time. And the most recent knowledge about this variant, the UK variant, South African variant, the Indian variant, actually there are two groups of data which tell us that the vaccine they have are still effective against them. The first group is the lab data. Actually, they have studied the variants in the lab, and they find that the features of the outer coating are not completely different from the original virus. So the antibodies in the body produced as a result of vaccination are still able to recognize them and attack as a result attack the variants. This is the first group of data. The second group of data actually is a real world study data. What is happening in many countries over the world where vaccination has been carrying on. So ongoing studies actually suggest that our available COVID vaccine now actually highly protective against the variants that we know that were mentioned just now. And even against fatal variants, even again it can actually uh, protect against the efficacy against severe or fatal COVID-19 caused by variants. The efficacy is 97.4%, as reported by Dr. Anthony Fauci just 2 days ago. Uh, so, uh, uh, so no, the picture has become even clearer just these few days.
Thank you,
Yes,
Dr. Yap. So what I understand is the vaccines we have today, they are giving us protection even against the variants. Is that
yes,
correct? And they
yes.
they at least protect us from the severe forms of the disease. We don't get hospitalization. Maybe we don't have to be hospitalized, and maybe we don't have to death. Is that correct?
Yes, the real world data show that protection is just as effective.
Okay. Thank you so much, Dr. Yap.
You're welcome.
Yeah. So we would go on to the next issue surrounding vaccines. Now, our national COVID-19 immunization program targets to vaccinate 80% of the target population by February 2022, next year. And the reason being that only if we are able to vaccinate a large percentage of our population, we should be able to have herd immunity. And herd immunity is supposed to be, will protect people better, and the cases of infections will go down drastically. Now, Dr. Amelia, I would like to ask you, could you explain what is this herd immunity and how does it work to protect communities?
Right. Right. Herd immunity. I'll try to explain it simply. Now, herd immunity is when majority of population is immune to the disease. So we'd like to quote 80%. Now, I like to use the umbrella analogy. The umbrella being the vaccines, and the rain being the virus. So umbrella and rain, vaccines and virus. So imagine there are 10 people out there on the field, and it looks like it's going to rain, but only 5 people decide to buy an umbrella. So the other 5, one cannot afford an umbrella because he's too poor. The other 4, uh, you know, just decide to not get any umbrella because they just don't want to. If it rains, probably they'll share the other people's umbrella. Now, if it rains, we know for sure those with umbrella, the 5 people, will be dry. Likewise, if COVID-19 attacks us, the 5 vaccinated people would be fine. But the other 5, if they don't get covered by the 5 people with the brollies, with the umbrella, they might get wet. So if it's drizzle, it's not too bad. The 5 people can share their umbrellas with, for example, 2 others without the umbrella. But 3 people without the umbrella will get wet. So 3 people will get COVID-19 infection. What if it rains cats and dogs? What if it rains very heavily? The 5 people will try and keep themselves dry, but at the same time, the other 5 without the umbrella would want to seek cover too. So, in the end of the day, everyone will get wet, and the wettest will be the ones without the umbrella, but even the ones with umbrella will get wet because their umbrellas are being shared by those without. So that is why some people who are vaccinated, if we haven't achieved herd immunity, where the majority of people own umbrellas, even the vaccinated may get infected with COVID-19. But, just mild symptoms, not severe symptoms. But those without vaccines, those without umbrellas, will get drenched. So, but if 90 or 9 people or 8 people own umbrellas, if it rains, if they all huddle together and put the brollies on top of them, they'd be able to cover all 10 of them from the rain, and everyone will be dry. So that's the analogy for herd immunity. We want at least 80% of the population to be vaccinated so that on top of protecting ourselves, we can protect those around us. So we have to encourage people around us to be vaccinated so that we can strengthen the protective layers around us and form herd immunity as soon as possible. Is that okay, the explanation about the
Yes,
analogy, Ms. Mangles?
Good.
yes. The analogy is good, but I was thinking of 10 people sitting at a dining table, like a family reunion dinner, and they're
Right.
all sitting close. Your analogy of the umbrella was good because they can't maintain social distancing. Am I right? So they're all very close under the umbrella. So if without that social distancing, it is even easier for COVID-19 to spread. This is what I was thinking. So anyway, what it means, in fact, the
I
what?
think that's a different concept.
Okay, okay. I've got a
Just the
little video
concept, just
here, which
illustrating the concept.
yes. Let's hear from Dr. Yap. Yeah, Dr. Yap, you would like to share your view on that herd immunity?
I think she has said enough on that.
Okay,
Yes.
all right. Let's give what I understand from herd immunity is when in a group of people, all right, whether it's 10 people or more, uh, if only 2 or 3 are vaccinated, let's take, for example, in a family gathering, you have a newborn
Okay.
baby, a full
Okay.
moon celebration, and
Okay.
then you invite all the relatives and all. If out of 20, 30 people in that gathering, only say 5 are vaccinated. Now, how, and let's say we have people who are come for the gathering, uncles, aunties, but some of them may be asymptomatic,
True.
nobody knows that. So in this
Mm-hmm.
scenario, this is just a scenario, how will COVID spread?
How will COVID spread? So I will go to 3 points. Number one, COVID-19 spread mainly by airdrops coming out during briefing, and loud talking, singing, and exertion increases this because this also produce smaller droplets which can stay in the air for a longer period. Second point, closed environment and crowdedness. For example, if 20 to 30 people gather in a house, the most likely is a closed environment and there is crowdedness there. And that increase the risk of transmission. So point number one, number two, these factors should be reduced, can be reduced by wearing a face mask and no social distancing. At that point, touching surfaces and objects where the droplets have fallen upon, where the droplets have settled, also can be a route of transmission of the infection. So this that's why frequent hand cleansing is important. Okay, that is on the spreading part lah. Yes,
My
that
question is, Dr.
it
Yap,
let's say okay that some of them is vaccinated.
ah,
Uh, Now and then the gathering it consists of both seniors and juniors, including those who are less than 18 years old, who are not included in the vaccination campaign currently, because the trial so far, those trials that have been completed last year actually, are
yes,
more for people above 18 years old. Only this
Yes.
year, the trials are being started on vaccination for those below this age group. So if a gathering consists of both senior and juniors, even though 80% of them are vaccinated, is that there is still quite risky of getting the infection.
Yeah,
In fact,
it could
2013
spread.
is too big a crowd. The crowd needs to be smaller.
Mm,
And even with the smaller crowd, strict
mm.
SOPs need to be followed.
Yes. The
So,
reason I ask,
yes,
yes,
if
the
someone
re-
now, if there's higher percentage of vaccination in the community, let's say 90%, then in a gathering like that, the risk of the younger people getting infected will be less.
Yes, that's what herd immunity also
Yeah.
explains. We need a higher percentage of people in gatherings to be vaccinated so that those vulnerable will not get. Yeah, thank you, Dr. Yap.
You're
And I'd
welcome.
like to ask Dr. Paran, as Dr. Yap mentioned, those below 18 years will not be vaccinated now in our, however, they can also, of course, be infected. Yeah. So parents, they like to take their children out to shopping malls, and sometimes teenage children below 18 years, they also like to hang out. And at the moment, our vaccination rates are very low. I think it's only about 4 or 5% of the target group has been vaccinated. So, what is the advice to parents who would do this? Maybe, of course, during MCO now they cannot, but when we relax, like in CMCO or RMCO, yes.
Yeah, yes. That's another important point. Um, let me go by the SOPs. Currently, the SOPs are quite clear, but there is, at the moment, there is no restriction yet on bringing children out or even teenagers hanging out in malls and shopping complexes. Yeah, but it's definitely a good idea not to bring these children out. Yeah, or even for teenagers to go out to meet their friends unnecessarily, as they are all not vaccinated. These children and teenagers, they are not in the group for vaccination yet. Yeah, though they may be more resilient compared to the elderly, sick ones, yeah, or those with comorbidities or multiple illnesses. But there is concern that the asymptomatic ones, some of those who are infected, they are asymptomatic, and they are the ones actually causing a major spread of this virus around. Yeah. So, and there's also reports recently that some of these younger ones are also getting infected, and some of them are actually getting admitted, and there's even been a few deaths among very young ones. Yeah, even less than, very young, less than 20 and all that. So I think we need to have a balance. We have to be patient. Of course, we are concerned about their well-being, about the social, what they call well-being. Yeah, they want them to we want them to socialize and all. But I think our priority should be clear. The safety of the children is very important, and it's not only the children, because they are also a potential source of spreading the viruses around. Yeah, so ultimately all of us should be safe. Yeah, not only children, the adults as well. We want to prevent the spread of virus. Yeah, so that the number of cases will come down, and also the severe cases and admissions and people dying will come down. Yeah, perhaps at a future period, sometime in the future, when a significant number of our population has already been vaccinated, as herd immunity has been discussed just now. So when or we are close to herd immunity, then maybe perhaps the authorities can start considering to relax, these issues on going out and bringing out the children. Yeah, but at the current moment, definitely my answer is no. It's not advisable to bring them out. Yeah.
Yes. Thank you so much, yeah, Dr. Paran. I'd now like to ask Dr. Amelia just a quick question on, okay, some countries have been rolling out their vaccination programs very early, I think like US and UK and so on. Now, and the latest we heard that the CDC in USA has just said that those who have been vaccinated don't have to wear masks. Now, can I ask you the question whether we in Malaysia can those who have been vaccinated stop wearing masks and don't maintain social distance? Can they let their guard down?
I think you know the answer to that one. Being
Yes.
vaccinated doesn't make you invincible to the disease. As mentioned earlier, the vaccines do not give 100% guarantee against COVID-19. It is just one layer of protection, albeit a very strong layer, but there has to be other layers on top or of the vaccines. So we still have to wash our hands. So hand hygiene is as important. So is wearing a face mask properly and social distancing. So each will provide a layer or a barrier against COVID-19 infection. So just because you're vaccinated doesn't mean you can, let your guard off. You need to still follow the SOPs, wearing masks, wash your hands, keep the distance, and hope herd immunity can be achieved as soon as possible.
Thank you, Dr. Amelia. Dr. Yap, what is your take on that? Why did the CDC in US say that those who are vaccinated can take their mask off and no social distancing? Is it they want to encourage more people to get vaccinated?
Well, the USA is among the earliest country to start vaccination, and the percentage of population vaccinated there is very much higher than Malaysia. So what apply there actually doesn't apply here. Whether they they said that whether not their newest opinion that there's no more such high need to wear face mask there. Well, in a way, also uh, uh, encourage people to go back for vaccination as soon as possible so that they can enjoy these benefits of um, not required to
Yeah,
wear face mask.
yeah, that is
But
what.
it doesn't apply here yet. We
Yes,
can't do
we have
that
a
yet.
very low percentage. Yes, I understand. I'd like to ask Dr. Paran one more question. Dr. Paran, these countries which have been rolling out their vaccines very early, are we seeing the results of the vaccination? Like, for example, UK at one time, they were the worst affected country in Europe. You know, the cases of COVID-19, and then they went on this massive vaccination for their people. Now, what are the results we are seeing from these vaccinations?
Yeah, thank you. That's a very important point you brought up. So, looking at UK actually, from what we understand, they've vaccinated about 95% of the vulnerable population in the UK itself. So that's almost like close to 100%. Yeah. So, and because of that, we see the data, the number of cases of serious cases and admissions have really come down actually. And in fact, some reports I've even seen in the news that the ICUs are close to emptied or even being emptied of serious cases. Yeah, people have been posting pictures on that. Yeah, so but we are nowhere near that. As you can see in the news lately, our ICUs are getting filled up. In fact, many of our states, including Pera especially, the ICUs are full or close to capacity. So we are nowhere near these countries. And if you look at their figures, they've vaccinated something like 95% of the vulnerable population, and close to about 50% or so about of the total population. For Malaysia, our rates are nowhere there. It's actually only about 5%. Yeah, in fact, it's lower in some places, somewhat higher in certain areas, but generally in Perak, it's about there. Yeah, so we are nowhere near the rates being done in these Western countries. So, because of that, we are not seeing the reduction in cases so much as you can, if you're mentioning UK and so on. Yeah. So and because of that, we still have to maintain our usual, SOPs and keep our guards up. It's too early. It's premature to let our guards down. Yeah.
Okay.
So, yeah.
Yeah, thank you, Dr. Paran. So actually, we have to now get as many people registering for vaccination as possible. And as Dr. Paran mentioned, PAROC, the vaccination registration for is still low. So I'm just wondering, maybe it's also because a lot of people are not tech savvy to use the My Sejahtera app, and as well as the websites and so on. In such cases, Dr. Amelia, any suggestions how we can increase the registrations of those for vaccination?
Right. Now, registration can be done via MySejahtera if you have smartphones, or it can be done manually at any clinic kesihatan. So just go to your local clinic kesihatan and inquire about vaccine registration, and it can be done. I think the society, the community has to feel responsible about registration. I mean, the community can be empowered to do their own vaccination, to do their own registration drive. For example, I'll share what I actually asked my teenage sons to do last month. I sent both of them to each to some of the houses in my village where I know there are elderly couple without children who do not know how to use
Okay.
smartphones and my Sejahtera. I actually sent my sons to go and register for vaccination for these couples, and yeah, and all the elderly people that they've helped registered are already vaccinated. So I think each community has to, feel responsible, find out about their neighbors, their loved ones, whether these people have been vaccinated or not. Because, as I've mentioned earlier, you want people around you to be vaccinated because they will add the layers of protection around you, the herd
Yes,
immunity.
yes, that's
So
what we want.
feel empowered to do vaccination registration drive. Don't just wait for the authority to do everything.
Yeah. Thank you. So the community has got to get involved, and we try
Definitely.
to have outreach registration. Dr. Yap, I'd like to ask you about this people's representatives, because every constituency in Malaysia will have a state assemblyman and an MP, right? And they have the demographics of all the people, all their constituents. Do you think that they can be setting up, some kind of registration exercise for all? Because at the end of the day, as our DG of Health said, we want equitable vaccination.
Yeah, yeah, agree with you. Now, as far as the doctors in private practice is concerned, a number of private clinics they are already offering help to the public who need help to register for vaccination. It'd be very lovely if all elected representatives at state and parliamentary level are, or, give priority to on this matter, uh, helping those who are more disadvantaged to help them to get registered for this vaccination, especially in view of the fact that today, for the first time, the number of new cases exceeded 6,000. First time. So it's a matter of urgency. So it would be lovely if our representative, elected representative, give this urgent priority.
Yes, thank you so much, Dr. Yap. I think that is one thing I hope they all will look into it, simply because they have all the contact details of all the people, especially in the remote areas who cannot be reached where they have
Certainly.
no internet. Yeah.
Yeah, yeah. Yes.
And Dr. Paran, one last question, and I'm putting it to you before we start winding up. This thing about equitable vaccination, all right? And as our DG himself has said, no one is safe until everyone is safe, all right? So how do you think our vaccination program can go? If how are we going to reach all these people out everywhere.
Right. I think I mean, just to add on what our previous speakers has mentioned, we need to improve the registration rates. Yeah, get the whole community to come down and assist all these people to vaccinate. I mean, to get registration for vaccination, and hopefully we will get adequate vaccines. I think the ministry is trying to procure as many vaccines as possible. They're all in the pipeline. So once everything is in order, I think we should reach our vaccination rates. Just how long it will take and how soon, that's a different question altogether. Yeah, won't know. But at least for the community, they can help to register as soon as possible, so that we can all get protected as soon as possible. Yeah,
Yes, and
that's what I'm saying. And
yeah,
I think
thank
we
you.
should learn lessons from, say, for example, India. Many of them actually let the guard down when the cases came down, so
Okay.
many took it easy, and you can see what has happened there. Many people have died recently. The people running out of beds in the hospital, they are just being overwhelmed. So I think we can take this as a lesson. We should not let our guards down. We should continue with our current SOPs and strengthen the vaccination program. Yeah, very much. Yeah.
Yes, and actually, this surge in infections is quite preventable, isn't it? If people were to follow all the public health measures, the SOPs and so on. So, uh, what do you think? I mean, once we can reach herd immunity, then we can uh, relax all these, like wearing mask and so on. Is that correct?
Yeah.
Hopefully.
Uh, well,
Yeah,
there's
look
a
forward to that.
Yeah,
We look forward.
we
Yes,
all look forward to that. I think everybody is bogged down by these COVID restrictions, and it's already almost more than a year. Yeah, we would
yes.
like it to, come down, but then it's definitely premature. See, but
Oh,
as you can see, some of the countries are already starting to do it with that, but we are nowhere near them.
yeah,
So it's
yeah.
definitely premature. But again, it's also an incentive. We look at these countries and they say, yeah, many have been vaccinated, so now they're letting down the guard. So in a way, I think it's an incentive for all of us, yeah,
Oh,
to get
yes,
vaccinated
indeed.
as soon
Yes,
as
yes,
possible.
indeed. Because when you see these countries, their businesses are opening up, their economy is opening up, their leisure activities, travel, they're having
Traveling,
travel
right?
bubble, and so on. So all we need to do is get the majority, at least 80% vaccinated, and that is not an easy exercise. Yeah.
Yeah,
Okay.
so it's
Anyway, uh, before we close, can I ask each of you to give what message, what takeaway message would you give our viewers regarding COVID-19 vaccine? We'll start with Dr. Amelia. Yeah.
Okay. I would urge everyone to help us strengthen the vaccination program and help us achieve herd immunity by registering for vaccination, um, enabling others who haven't registered to register, come for registration, and continue to adhere to all the SOPs, and hopefully we can achieve herd immunity as soon as possible.
Thank you, Dr. Amelia. Dr. Yap, what would be your takeaway message?
yes, our grandparents went through First World War. Our parents went through Second World War. This generation is facing COVID-19 pandemic. I think one important lesson we learned with this pandemic is the importance of healthcare, and that prevention is very important. Uh, Very important tool and weapon to control this pandemic. And so it's important to keep ourselves healthy physically, mentally, and socially, and also observe the SOPs, and of course, vaccination.
Yes. And that is the way to move forward. Yeah. Yes. Thank you, Dr. Yap. And Dr. Paran, what would you like to add to this?
Okay. I'll say. All of us should protect ourselves as much as possible, keep fit mentally, physically, and emotionally. Yeah, and we should take the vaccine to protect ourselves as well. And if anyone is at risk or if they're infected, they should actually quarantine themselves and do not spread it around. Yeah, this is one of the few infections which is spread by humans. It's not rats, it's not mosquitoes or any other agents. It's humans. Only by human is spreading to another human. So if only everyone stays at home, do not unnecessarily move around for even a few weeks, the virus will naturally die down and cases will reduce tremendously. Yeah. So, but end of the day, I think all of us should come out of this catastrophe well enough and alive. Yeah, that is the most important thing. We should be alive by the time this COVID epidemic is over. So that is my message, and I wish everyone stay safe.
Thank you, Dr. Yap. Sorry, Dr. Paran. Dr. Parantaman,
Okay.
thank you. Okay, on behalf of Family Wellness Club, I'd like to thank all of you all, Dr. Amelia, Dr. Yap, and Dr. Parantaman, for spending your time and advising our viewers and giving the facts on the COVID-19 case. Yeah, and we hope
Welcome. Our
that
pleasure.
para registration goes up soon after at least this talk. Thank you.
You're welcome.
Welcome.
Okay, thank you. Our pleasure to help out.
Yeah. Well, we have heard from our panel of speakers. I think they made it very clear. We have to follow the SOPs, and vaccination is very important. And the most important thing is we want to get herd immunity, for which will protect everyone. All right. So with that, I'd like to thank all who have taken the time to watch our event today, and I hope that you have found it useful. The recording of this live event will be on our Facebook page, so anyone can view it anytime. And if those watching, you have found it helpful, please do share. You'll be sharing reliable information on the COVID-19 vaccine. Thank you, and stay safe, stay well.